I'm concerned about a couple of my horses, and I have a lot of questions. So I have the vet coming here today, and I also have I have Rosie, who needs her blood drawn to make sure that her kidney and liver functions are well, and then I also need to have some vaccines done on my pregnant mare. My name is Brandi. Welcome to my channel. If you're new here and you want to learn more about horses and follow my journey with horsemanship, you can start by subscribing and dinging that little bell so you don't miss out.
I watched all 5 videos.
Oh, did you? Oh, good. Good. So, is she just the cutest thing you've ever seen?
She really is cute. She really is cute.
I got some funny looks at the gas station when she was neighed.
Well, I mean,
when she whinnied at the people next to me, they're like,
how else are you supposed to travel that far?
It worked great. It worked great.
I'm not putting her in a trailer.
Yeah, it worked great.
Silly.
Okay, so yeah, she needs blood draw just to make sure that kidney and liver is functioning normal again.
Seeing the AST and the GGT were elevated because I paused it. I paused the video on the blood work.
Okay, perfect.
And I'm like, okay, I know what we're working with.
Yeah, great.
You know, and I saw her ulcers. And I'm like, all right, I know what we're working with.
Isn't that perfect?
It's great.
So
I saw
cool.
her X-rays. I can pause it on the X-rays. I'm like, okay, I see what you're seeing. Okay,
Yep.
life is good.
Yep.
Like, that was beautiful. That was
Yep.
like the most concise
Yep.
history that I could have ever asked for.
Exactly. That makes things so much easier.
It was lovely.
Yeah.
So when did all that happen is my question.
That was January. So
Okay.
that was like the 17th of January, I think is when I hauled her there.
So we're like 2 months out. Okay, perfect.
And they said to give her at least 2 weeks before doing the blood draw just
Yep.
to make sure that
Yep.
everything was kind of back to normal.
Absolutely.
So
Did she ever have bad gut sounds?
no, her belly was making a lot of noise. So there was a lot of movement and sounds. So, and she was pooping and everything. Minis and ponies are so jerky. Like they're so quick to. Oh, gotcha.
She's like sitting on, just leaning on me.
There, good girl.
This is because you watch the videos and you're like, she's gonna be so easy.
Nice. Never say that. She's like, okay, fine. Okay, so Muffin, do we want to look at Muffin? So this is Muffin, and my concern is, like last year, she kept her winter coat until sometime in June. And I see no other like physical issues at all in her, like her energy level's fine, all that. I don't know anything about Cushings. I've never researched it at all. But it just kind of, I know Danny had a pony that had Cushings, and so it just kind of concerns me. But what do I look for? What do I do?
So equine Cushing's disease is also known as PPID, or pars pituitary pars intermedia something or other. PPID. That's the other way of researching it.
Okay.
The literature is actually shifting away from Cushing's because Cushing's disease is a disease in dogs and humans.
Oh.
And when horses get Cushing's disease, it's a completely different process.
Okay.
It's a completely different disease. So
Okay.
we're trying to get away from Cushing's disease,
Okay.
even though it's what we all know
Okay.
it by. So that being said, so Cushing's disease.
Yes. Yes.
So we're going to have to talk about PPID and Cushing's disease. So PPID in horses is where in horses that are statistically, when they're over 15, they are more likely to get this condition. What it is a condition in their pituitary gland, which is in their head, and they usually get their pituitary gland gets bigger.
Okay.
Sometimes it's due to a tumor, sometimes it's due to just the pituitary gland getting bigger.
Okay.
And when that gland gets bigger, it produces more hormones.
Okay.
And by producing more hormones, we get effect.
Okay.
About 80% of horses that have been diagnosed with Cushing's disease or PPID, there's reported hair coat changes. That can range anything from lack of shedding out to thick hair coat to a curly hair coat. Like if you Google images of PPID in horses, you'll see like these woolly mammoth looking horses that have like these really like teddy bear looking hair coats.
Sure.
It can range anything from that to lack of shedding out or just some weird changes that happen. That's usually the first reported sign and the most common reported sign. Other things that can happen in PPID, they can have weight loss, they can have muscle atrophy, they can have energy changes, they can have weird fat deposits,
Okay.
Like thick crusty neck. Those are some of the traditional things that we think about in Cushing's horses. There can be a whole other host of
Issues.
signs. How old is Muffin?
19.
19? Okay. So we're within that statistical. Chances are, if we play statistics on it, she's probably got something. It's just, is it detectable or not? Cushing's disease is it can be a difficult thing to get a definitive diagnosis on. Sometimes we can't get a lab result to say yes or no, and we just have to say, well, based on signs, based on presentation, what she's doing, we're just going to start her on some meds.
Okay.
If we talk about testing, there are a few different ways that we can get to a diagnosis. None of them have the greatest 100%.
Yeah.
In the event that she's early in PPID, in her presentation of things, it's even more difficult to come to a diagnosis on things. In horses, we test for a compound that's called ACTH. It is the kind of the boss molecule that tells the pituitary to secrete stuff. Right? So if we test for that and that's high, then that's telling the pituitary that it needs to kick out a bunch of hormone and cause an effect. So if we test for that mother molecule, so to speak, then the chances are that we have a pituitary condition. Testing a resting value is okay in some horses that are later in their disease process. So if we're early, we might not have an elevated ACTH. We can also look for that same component, but we kind of challenge her. So we draw a sample looking for ACTH. We give her a chemical called TRH, thyrotropin releasing hormone, and that basically gives the pituitary a little bit more enthusiasm to kick out more. So we draw 2 samples of ACTH looking for a difference in a before and after. And that is a much more sensitive way, especially in early cases, to pick up whether or not we have PPID, Cushing's disease. Other things that have been done, looking at cortisol, because that's in humans and dogs, that's what we look for in Cushing's disease. Not really the greatest thing at figuring out, is this Cushing's disease or is this not Cushing's disease? Sometimes we can go on clinical signs and do a chemistry, because these horses often have they can have some changes on a chemistry panel that can be a little bit more supporting evidence in going down the are we Cushing's disease, are we PPID road or not. So long story short, it can be difficult to get to a diagnosis, and sometimes we have to test and retest or just go based upon clinical signs and presentation of do we treat or do we not treat. Treatment for PPID is a medication called Pergolide, and it's readily available. It is a little bit on the pricey side, so this is where we balance do we wait for that positive test result before we put the finances into treating or not? And that's where we have that conversation between you as owner and me as veterinarian to make that decision for her.
Pricier, like in the roundabout.
I want to say it's a couple $100 a month. So it's doable. It's doable, but I'm not just going to willy-nilly spend $200 a month.
Exactly. If you don't have to.
For nothing.
Exactly.
Right? I want to have a little evidence to show that yes, we are or no, we're not.
This makes sense to treat.
So kind of tied into the Cushing's disease and PPID talk is another metabolic endocrine thing. It's called equine metabolic syndrome. So In recent years, these two conditions have been peeled away from one another.
Mhm.
They're similar in a lot of ways, but they're different in a lot of ways as well.
Mhm.
So in the event that, you know, say we tested for PPID
Mhm.
and she came back negative, we retested, she's negative, all right, I'm a little bit more convinced that maybe she's not PPID,
Mhm.
maybe she's equine metabolic syndrome.
Okay.
You know, that's another thing that I'm kind of thinking in the back of my head.
Okay.
Statistically, equine metabolic syndrome horses are typically younger
Okay.
and PPID horses are older.
Okay.
But PPID has been diagnosed in horses as young as 5.
Okay.
And equine metabolic horses have been diagnosed in horses as old as I think 15.
Okay.
So there can be rules that are broken.
Okay.
So
Okay. All right. Well, so the best thing to do probably at this point is to watch and see how it pans out this year.
yeah.
You know, because she really didn't want to. She didn't want to shed out so well last year. She did start shedding like the first week of January this year, which was like a lot earlier than she normally does. But she's never rocked a beard quite so intense before.
Yeah.
So, and this real long
Yeah.
stuff.
I would put her based upon what her hair coat looks like. I would say if she doesn't shed out
Yeah.
perfect 100% like all the other horses,
Yeah.
I would put her on the list of horses to treat
Okay.
or to test.
Yeah.
And if we test and we are
Yeah.
positive, then we treat.
Okay.
And she could potentially resolve all of her hair coat changes. And like I said, sometimes it's amazing what PPID and like the disease process does to their energy level and
Okay.
their muscle tone
Okay.
and their crustiness. So sometimes there are those changes and they're just more subtle and we don't pick up on them because their personality is just this perfect little button.
Yeah.
Right. And sometimes when we add that treatment in, then we get a little bit more pep in our step.
Okay.
We get a little more enthusiasm towards,
Okay.
oh, hey, let's go do 20 miles.
Yeah.
You know?
Okay.
So,
All
I'd
right.
say if she doesn't shut out,
Yeah, and
I'd
she's
test her.
she's definitely the type to go all day. That's her. I did just put her on a supplement too to see, well, maybe this'll maybe she's missing something, you know, so I did put her on
Yeah,
that, but
good.
so
Good.
we'll see how she sheds out and go from there. Okay, so I know what to do. So we'll look at that for next year. Okay. So the next one is Miss Kitty, and she's just been off, a little sore she's sore in the hind. She's 26. She's one of my main lesson horses. I have now moved her to being just for like the little kids. She does still do canter work though, and she's happy as can be to go on a trail ride. But I want to make sure that she's not, I don't want her to be uncomfortable while she's working. So I had her on Previcox. I did take her off of that. Well, when she ran out of it, I didn't get her more because it really didn't seem to be helping.
Okay.
So, and I can tell by looking at her sometimes, she just looks uncomfortable. And I want to make sure that, you know, when she needs to be retired, I want to retire her. I don't want to keep making her work if she shouldn't be working.
Okay.
She seems to do better with exercise. But what's so do you want me to just move her around in the round pen?
Yeah, let's start with that so I can see how she moves.
Okay.
And then we can either get her out or I can go in there and I'll check all of her joints, put her through range of motion, see if there's any specific joint.
She did one time boa tendon.
Okay.
A few years ago. She boa tendon, she was off. I just didn't use her for anything for like the whole winter. And then she was fine from springtime, but I just moved her to a smaller pen in November or December, probably December. Could be January, now that I think about it. But anyway, I moved her to an area now where she doesn't move around a whole lot at all.
Okay.
She kind of just stands and eats, because she doesn't have to go anywhere. Her food and water's all kind of in the same spot. So, yeah, this is the worst I've seen her in a while.
Okay. Let's see what she does the other way. she tells me. So based upon watching her move, I'm gonna be looking at her right hock and her left front carcass.
Okay.
So I don't know if what I'm seeing in her front end is a result of how she's moving in her back end and it's just a compensatory thing, or if we have two things. With being her age, she's the equivalent of a 75-year-old baby. So the fact that she's got arthritis a whole bunch of places, it's not really going to surprise me.
Yeah,
It's just how severe
exactly.
and where is it at?
Yeah.
Is my question.
I did just discuss with my mom a retirement option for Miss Kitty. She was born at my parents' farm, and I don't have the space just to have a horse retire, so to speak. So we talked about her being able to go there and be back with her old buddies who are also retired.
Is this the leg that she bowed attended?
It was a hind leg that she bowed.
So she definitely has decreased range of motion in the carpus.
Okay.
So we call it the knee.
Yep.
But it's, I know. Let's mention on it. It's actually equivalent to our wrist.
Okay.
Because a horse actually walks on the equivalent of our middle finger. So that joint is equivalent to our wrist. And when I flex that, she should be able to almost lay it flat up against that. And she can't quite. She can get pretty far, but not really.
Yeah.
And just like how we can do side to side on our wrist, she can do that a little bit, but it's definitely not as much as I would like to see.
Okay.
It's probably arthritis. I know. I'm gonna check your shoulder now. Ooh, yeah. Okay, we're done. I won't check your shoulder then. I won't do that. So I'm also seeing and feeling some muscle atrophy along her gluteals, in her bicep, and I think I'm convincing myself more and more along her shoulder. So just like, your grandma in the nursing home is going to start to lose all that muscle mass, that's where she's at. Again.
Well, and what's funny too is when I moved her from the herd into with this pregnant mare, I upped her grain because she just looked like she was getting a little thin to me. Upped her grain, and she actually got really fat. And I recently reduced it again, and now I've been looking at her again, and I'm like, gosh. But she's been completely out of work all winter. I have not worked her at all.
Yeah.
So, but yeah.
Because what she does have up here is fat, not muscle.
Yeah.
So again, being out of work,
Being standing around.
Yep. Being a senior that's, not getting out and doing those daily walks is probably not doing her any favors.
Yeah. So you need to move her more. When I'm trimming her too, I don't remember which hind, but there's one hind that's stiffer than the other too, as far as just like bending it just to trim it. I have too many horses to remember which foot it is though.
Yeah.
This one has one too.
Subjectively, she seems like she has better range of motion in this left than she does the right.
Yeah, in her right, when she travels, she drags that toe. So it's definitely the right that that's the case.
Her heart sounds lovely on this side. Yeah.
She says thank you.
Yeah. True story. True story, Mama.
She is she's a face sniffer. She always will sniff your face.
Yeah.
I don't let a lot of horses do that, but she's been doing that to me since she was a baby.
So this
one,
compared to her right carpus, so I'll do my right, my left for her. So when I picked up her feet and I kind of did this with her carpus, her right, I could do about like this,
Uh-huh.
when I should be able to do about like that.
Okay,
On her left, I can get
okay,
about like that.
okay.
So she has no lateral movement
Uh-huh.
in that
Okay,
front left
okay.
carpus.
And with the front left, something else with her too, that might be why it happens, but her, see how her hoof is
Yeah.
like crooked? Like
Yeah.
it's just different
Yeah.
than the other one. It's kind of funny.
And it might be wearing like that because she's compensating on how she's moving.
Okay.
That it's very often that when we have a lameness in the back, that we get a lameness in the opposite front.
'Cause it's doing so much more.
Yep, because how we're moving. And just like you wear the soles of your feet, like if you walk,
Yeah.
like toes out or toes in, like you're gonna wear the soles of your feet differently. She's doing the same thing. So it wouldn't, I guess that doesn't really surprise me that she's maybe wearing a little different, because I can tell you that carpus is really ouchy.
Okay.
So, I would say, I definitely want her to have some exercise, because yeah, but it's going to be with the
thank you.
yes, but it's going to be with the condition
Yeah.
that it is. I'm not even going to use the word light. I'm going to do minimal work because of the definition of light work.
Yes.
I want her to walk, a little bit of trot, a light rider only.
So my kids.
Yeah.
Perfect.
yeah.
Okay,
So-
you guys have to ride. Tova and Bodhi, you have to ride Miss Kitty.
Yep. Because the more muscle tone that we can keep on her, or if we can get her a little bit more muscle tone, that's going to help support her joints
Okay.
more and better. And it's going to make her feel better because she has more support. I would like her to be on your favorite glucosamine chondroitin,
Okay.
whatever your favorite is. I would absolutely love her to be on one of those.
Okay.
And I think an anti-inflammatory of your liking. She's going to be on
So
a long
Butte?
term. So you can either do Butte kind of on an as-needed basis,
Okay.
because of the whole risk of ulcers,
yeah, I
kidney
don't wanna
issues.
go there again.
We're not doing that again. So Butte intermittently would be totally fine. The other alternative is something like Previcox or Equiox.
Okay.
Those are very safe for long term. They don't have the whole gut ulcer problems that Butte does.
So, but if I tried the Equiox and added glucosamine injection as well,
Yep.
that might be the ticket there to making her
I would
way more
love that.
comfortable.
I
Okay.
would love that a lot.
I had a problem last year. I had 7 horses react to West Nile.
that's
So
a
with her, do I need to vaccinate her for that right now, or can I wait until baby comes? Like how?
We're going to wait until baby comes.
Okay.
Because with West Nile, the way that vaccine works, some of the West Nile vaccines are labeled for pregnant mares.
Okay.
Some of them are not.
Okay.
And without calling my vaccine manufacturer, no. It's
No.
fine. It's fine.
Yeah, I'd
we're
rather go
gonna
without.
we're gonna hedge on herd immunity to
Yep.
protect her for West Nile.
Yep.
And then once she foals, then we'll booster her for West Nile.
Okay. She knows. That's her. And that's what she'll do when you do poker. Is she tosses her head like that.
Good. Oh, yep, there's baby.
Yeah. It's funny when you poke it, it pokes back. Oh my goodness. It's okay. Don't be so defensive back there.
Tell me how you really feel. Tell me how you really feel. 100.3. Perfect. What was the worst part of it, huh? What was the worst part of it? Hold on. Hold on. Hold on. Hold on. Hold on. That was it. That was it.
Well, folks, that's it for today. If you'd like to learn more, you can start out by hitting that subscribe button. Thanks so much for watching. Have a great day.